a newborn's wail shatters the quiet of a cramped Toronto tenement, and a frantic family rushes to register the baby before the deadline. It is the spring of 1911, and the city streets are already humming with a secret competition that no one expected to begin. Earlier that year, a prominent Toronto lawyer, whose wealth had been built on corporate law and land speculation, died leaving a will that would spark a race unlike any other in modern history. The will stipulated that a substantial sum, equivalent to several years' wages for a working-class family, would be awarded to the family that produced the most children within a 5-year window, provided the mother lived in a designated part of the city and the births were legally registered. The condition was simple on paper, but the promise of a fortune turned the ordinary act of childbearing into a public spectacle. The lawyer's bequest was not a whimsical gesture, it reflected a view that large families could help strengthen the nation, a sentiment echoed in contemporary debates over immigration and population growth. The will was published in the local newspapers, and the headline that followed read like a challenge: Stork Derby to determine a most prolific family. Within days, the downtown neighborhoods of what is now the core of Toronto were buzzing with a mixture of hope, anxiety, and opportunism. Tenement landlords, already struggling to fill crowded rooms, began advertising family-friendly apartments, and local midwives reported a sudden surge in demand for their services. The first beat of the story follows the ordinary families who saw the contest as a chance to escape poverty. A mother of 3, living above a small grocery, gathered her husband and children around the kitchen table, weighing the risks of another pregnancy against the potential payoff. In the cramped kitchen, the smell of coal smoke mixed with the scent of boiled potatoes as they whispered strategies about ensuring each new birth was recorded on time. Some families turned to relatives for help, arranging quick marriages or even temporary cohabitation with neighbors to meet the residency requirement. The city's birth registrars, overwhelmed by a flood of applications, extended office hours, and clerks found themselves stamping certificates at a pace that felt more like a relay race than a bureaucratic routine. The second beat escalates as the competition becomes a community-wide phenomenon. By 1913, the district's maternity wards were filled beyond capacity. Hospital doctors, accustomed to a handful of births a week, now faced a constant stream of laboring women, many of whom arrived in the early hours of the morning, driven by the urgency of filing a birth before the cut-off date. The air in the wards was thick with the smell of antiseptic and boiled liniment, and nurses worked in shifts that stretched into the night, their exhausted faces illuminated by the soft glow of oil lamps. Newspapers ran weekly leaderboards, listing families with the highest number of registered children, and each new entry sparked a ripple of excitement across the city. The competition was not limited to the poorest. Even a modestly well-off clerk in a nearby office decided to try his luck, hiring a local midwife to assist with a planned pregnancy. The third beat brings the human cost into sharper focus. As families pushed the limits of their bodies, the city's doctors noted a rise in complications. Some mothers suffered from malnutrition, as the need to support larger households stretched already thin resources. Infant mortality, already a harsh reality in early 20th century Canada, climbed as hospitals struggled to provide adequate care for the surge. Contemporary reports indicate that a local parish priest warned that the love of money should not outweigh the love of life, a sentiment that resonated with those who had lost a child to a preventable infection. Yet the promise of the prize kept the momentum alive, the will's conditions were unchanging, and the deadline loomed like a ticking clock. Mid-story, a turn arrives that reshapes the narrative. In 1915, a group of families whose children had been deemed illegitimate under the strict interpretation of the will filed a legal challenge, arguing that the language of the bequest was ambiguous and that the testator could not have intended to disqualify children based on the parents' marital status. The case made its way to the Court of Appeal for Ontario, where the presiding judge examined the original handwritten will, the surrounding correspondence, and the social context of the era. The court's decision, delivered in a measured tone, held that the will's restriction to legitimate offspring was enforceable, but it also highlighted a critical flaw: the testator had not specified a mechanism for verifying legitimacy, leaving the decision to the discretion of the registrars. The ruling sparked a wave of protest, as many families felt the law had been weaponized to favor the wealthier, more established households who could more easily prove legitimacy. The controversy forced the city to pause the competition for a year while a committee was formed to oversee a revised set of rules. The fourth beat follows the aftermath of the legal decision. The committee, composed of a mix of physicians, social workers, and a representative from the lawyer's estate, introduced a new criterion: all births registered within the designated area and time frame would count, regardless of the parent's marital status, provided the mother could demonstrate residency. This change opened the competition to a broader swath of the population, and the number of registered births spiked once again. However, the earlier controversy had left a lingering sense of distrust. Some families, exhausted by the endless cycle of pregnancies, chose to withdraw, while others doubled down, seeing the revised rules as a second chance. The city's newspapers, which had previously celebrated the competition, now published editorials questioning the morality of incentivizing childbearing in a time when public health infrastructure was already strained. The final beat brings the competition to its climax and its quiet end. Shortly after the 5-year window closed, the estate's trustees announced the winner, a modest family from a modest apartment block that had registered roughly a dozen children during the eligible period. The prize, a lump sum that would have bought a small house at the time, was presented in a modest ceremony attended by city officials, a few journalists, and a crowd of curious onlookers. The winning mother, her face lined with years of labor, accepted the money with a mixture of relief and resignation, knowing that the financial security it offered would be offset by the years of hardship that had accompanied the race. In the years that followed, the city's birth rate returned to a more typical pattern, and the story of the Stork Derby faded into the annals of local folklore. Yet the competition left a lasting imprint on the community. The tenement buildings that had once housed frantic families were eventually replaced by larger apartment complexes, and the neighborhoods that had been the epicenter of the race became known for their vibrant, multi-generational households. Historians continue to debate the broader impact of the contest. Did the influx of births provide a demographic boost that helped Toronto grow into the metropolis it is today, or did the competition exploit vulnerable families, turning the most intimate act of life into a calculated gamble? Even a century later, the question lingers in the archives and in the whispered stories of older residents: if a promise of money can turn a city's future into a race for newborns, what other hidden incentives might still be shaping the choices of families today? The Great Stork Derby remains a reminder that the line between public policy, private wealth, and personal desire can be as fragile as a newborn's cry in the night.